Once again, we'd like to welcome you to today's edition of The Morning Call. The Joint United Nations Programme on HIV and AIDS, UNAIDS, is calling for greater urgency and more funding in the fight against HIV and AIDS. In its annual report published on Tuesday on the global response against the disease, it acknowledged that HIV-related deaths in 2018 fell to around 770,000 compared to 2010, which recorded 1.2 million deaths. But what is the situation in Africa, the most affected continent? AIDS-related deaths have considerably dropped this decade due to steady progress made, especially in most Eastern and Southern Africa. The regions recorded a 16% decline since 2010, though the report warns that there's still a long way to go. North Africa, on the other hand, has seen the dot tell rise by 9% since 2010.
A decline due in particular to better access to treatment. And we have Dr. Mamadou Lamine Sako, UNAIDS Regional Advisor in Dakar, Senegal, on the line to give us more. Good morning and welcome to the program. According to the latest UNAIDS report, 770,000 people died of HIV in 2018 and 1.5 million were infected. However, the same report estimates that these figures mask some progress, particularly in Africa. Tell us more. Yes, there's significant progress in the fight against AIDS in our July 2019 report that we have published in South Africa, because we have seen that the number of deaths has decreased thanks to the progress we have made on access to treatment and improved HIV and tuberculosis services, particularly in South Africa, where there has been significant progress in reducing new HIV infections. This is by over 40%, and deaths have also been reduced to 40% compared to 2010. For UNAIDS, these are promising programs, but we must also recognize that in analyzing our objectives for the three 1990s, we recognize that not all countries and continents are on the same speed of progress. That is why there are countries that have very encouraging results. There are others, unfortunately, that are not at the same level.
And Mamadou, the report also mentions the disparity of efforts in the fight against the disease all over the world. What is the exact situation on the African continent?
Overall, East and Southern Africa still have the highest prevalences and situations. But nevertheless, it must be said, South Africa has an excellent result in terms of achieving the objectives of the three 90s. I mean that there have been significant efforts in South Africa to reduce new infections by more than 40% and reduce deaths by more than 40% compared to 2010. So there have been parts of Africa that have made great progress, but that is not enough. North Africa, for example, still has slightly higher rates compared to populations at risk of new HIV infections. West and Central Africa also have results, but not all countries are at the same level. That is why we believe that political commitment is important. It is essential that we consolidate a stronger political framework and try to have much more adequate and judicious long-term investments to deal with the epidemic in East and Central Africa. Not all countries are in the same place at the same speed as regards the objective of the 1990 plan that we have set ourselves. Finally, Dr. Mamadou, the report also highlights the thorny problem of financing. So what is the situation to date at the financing level? Well, in terms of finance, there is a gap between the needs that are really expressed by practitioners, patients, individuals, communities, and the real resources mobilized. We had planned 26 million 200,000 to be financed by 2020 But for the moment, there is a gap of $1 billion that donors have not been able to disperse, where there have been national commitments that have not been sufficiently met. So in 2018, we noted that more than $19 billion was spent on the fight against AIDS, $7.2 billion, less than the $26 billion planned. That is why we call on the international community, African governments and international partners and NGOs to continue to mobilize to meet these 390 goals if we want to eliminate AIDS by 2030. For us, the struggle continues, and we must make an effort and take up the pilgrims to stick and speak to heads of state, especially in Africa, so that they know that we still have a long way to go in the fight against HIV and AIDS.